Well, with 3 cases of COVID-19 and ongoing contact tracing to find out more, who are those persons responsible for conducting these tests? Well, joining us live in studio to shed more light on such a crucial service is Bernice McLean of the Princess Margaret Hospital and Bonaventure Culmer, who's the president of the Caribbean Association of Medical Technologists. Ladies, welcome to the Bahamas tonight.
Thank you. Thank you.
So Bernice, give us an idea of the role medical technologists play and how the work factors into what's happening regarding the COVID-19 outbreak.
Okay, first of all, I am a medical technologist, trained and certified, and I work along with a team of medical technologists, lab aides, phlebotomists, cytologists, histologists. We are a core group of highly trained personnel who actually exist in the bottom floor of the Princess Margaret Hospital. Medical technologists are individuals that actually will be doing the testings of these COVID samples, and we are the persons to whom testings will be performed. So therefore, we wanted the Bahamas Association of Medical Technologists thought it prudent to come forward to assure the public that in testings they're getting the best testing results possible. And we wanted to assure them as well that there's no need to be afraid in terms of the fake news that they've been hearing, because we at Princess Margaret Hospital, we can rest assured that everything is being done to make sure that whatever results are coming out, they are reliable and dependable.
So tell us what safety measures are being implemented.
Safety measures have been increased to the point that now we're using the face mask and the face shields. Of course, we are always adorned in our lab coats and our gloves. So therefore, all precautionary measures are in place and have been heightened. Our information is there with us, and that we have increased our protocols in terms of making sure that we are guarded against any type of aerosols, droplets. So therefore, all precautionary measures are in place to make sure that we remain safe.
And Bonaventure, for you, what are some of the safety measures implemented from your perspective?
Well, throughout the Caribbean, I've been hearing from my colleagues on the various islands, Curacao, St. Martin, Barbados, Jamaica, and a lot of them are directly involved in the testing themselves. What we've done with from the Caribbean Association of MedTech perspective is to really emphasize to the lab professionals to don't be too relaxed in your testing process. Take the extra precautions. We don't normally wear masks throughout the day in the lab, but we're saying because of this pandemic, we're asking these lab professionals, wear your mask, wear your gloves, wear your PPEs wherever necessary. Take special precaution even in drawing samples from patients. Don't let your guard down. We're all laboratories that observe the ISO 15189 standards. We all recognize international standards, so we know what to do. So CASMED is just asking the lab professionals to just be alert, be vigilant, take extra precautions. Don't take this for granted, because it is obviously a very serious pandemic.
Are you concerned?
I'm not concerned. I'm concerned about the pandemic and obviously anxious like most people are in terms of how long this is going to be. As a lab employer, we're also concerned. We trying to figure out now with the new guidelines in place, are we open? How long are we open? Are the patients going to be coming in? But whatever is developed as the guideline, we just want to say that safety is the utmost for our staff. So we want to make sure that they always take precautions.
And tell us, in what other ways will you be lending assistance at this time?
I was contacted by the COVID-19 task force, and if we are needed in terms of assisting with the sample collection, I want to put out a call to our laboratory professionals out there to make contact with the Bahamas Association of MedTech, so that if we're called upon, we will be there and we will be able to lend our services in terms of sample collection. The persons at the national lab are the ones that are doing the testing. It's not out at the private labs at this time, because we have been getting calls trying to find out, are you doing the testing? So it is not. We've all heard the protocol in terms of where testing is going to be and where the physicians are to send their patients. So we're all sticking with the national guidelines.
Okay, well, thank you so much, Bernice and Bonaventure, for joining us. We
Thank
appreciate
you.
the services you're
Thank you.
providing, especially at this time.
Thank you very
Thank you.
much for having us.
Thank you.